ECG of pacing through lateral cardiac vein. Pacing through lateral cardiac vein was done because of prior triple wall replacement, mitral, tricuspid and aortic, which precluded transvenous right ventricular pacing. The basic rhythm is atrial fibrillation and the fifth and last beats are paced. The tall spikes before the paced QRS complexes indicate the possibility of unipolar pacing, which causes tall pacing artifacts. QS complexes in leads V4 to V6 indicate an activation proceeding medially from the lateral wall of the left ventricle. This is quite different from the activation seen with the basic rhythm.